My name is Lulu Kupaza. I reside in Arusha, and today I am with, what's your name?
My name is Hamida.
Okay. Hamida, where do you live currently?
In Arusha.
In Arusha. Okay, and how old are you?
I'm 59 years.
Okay. And what is your marital status?
I'm married.
Married. And how many kids do you have? Two. Okay. And what is your occupation?
I'm a nurse.
A nurse. RN.
RN.
Registered nurse. Okay. And Hamida, what is your level of education?
Master's of Public Health.
You have a master's in public health. Okay. What is your position? Where do you work right now?
In Arusha, Meru District Council.
It's a hospital.
Hospital, yeah.
Is it public or private? Public hospital. Okay, and what is your position there?
Head nurse.
Head nurse. Okay. What is your, if you don't mind me asking, what is your individual income?
Individual income, 1.5 million per month.
1.5 million Tanzanian shillings per month. Okay. And could you tell me about a day in your life? How is your typical day?
Okay, when I wake up, I pray. Then when I wake up, I bath. Then I pray. Then I prepare myself for work.
Okay. And what time do you have to report to work?
7:30.
Okay. And how far, or what is, not how far, but what is the distance from where you live and
About 15 kilometers.
15 kilometers. So how long does it take you to get to work from home?
About 30, let's say 45 minutes.
45 minutes. And this is by what mode of transport? A daladala? Okay. And what time do you have to leave work?
3:30.
3:30. Okay. And once you leave work, what do you do?
What do you mean?
After you leave work, what do you do then?
After, let's say when I arrive home.
Yes.
Okay. When I get home, I get shower. Then I pray for this afternoon prayers. From there, I eat maybe early dinner. Then I pray for night prayer. Then I go to bed.
Okay. And when you say you eat early dinner, what do you typically have for breakfast?
Breakfast, normally I eat bread.
Bread and what?
Brown bread and tea.
Brown bread and tea. Okay. And why brown bread and not white?
I prefer brown because that is, at least is more nutritious as compared to white bread.
Okay. And what about for lunch?
Lunch, normally I don't eat lunch. I buy, let's say, just snacks.
Snacks. What kind of snacks? Samosas.
Chapati.
Okay. And you have that with what?
With maybe juice or tea.
Juice or tea. Okay. And what about for your early dinner, as you mentioned?
It depends. Sometimes rice and beans, or rice and meat, or ugali and meat. Yeah. Plus green vegetables.
Okay.
Yes.
Okay. And how is the health, your health or the health of your family? Tell us about your health.
My health is okay. Um, I'm healthy, but I have hypertension. I'm hypertensive patient.
Okay.
Yeah, but it's controllable.
Okay. And what about the health of your family
Yeah,
members?
my family is also a health.
Okay. And what about nutrition? Your family, with you and your family.
Yeah, nutrition. I try to make maybe nutritious foods like fruits, vegetables. Yes.
Okay. Okay. So what would be, could you describe a typical day of receiving health services or looking for health services? Like, for instance, if you or your family would need to go to the hospital to get health services, how, first of all, what is the distance of the health facilities, but also how do you get there? Just tell me generally.
Yeah. The distance in because I live in town, so it's not very far. It's like maybe 2 kilometers and or 3, and I go with the public transport.
Okay, when you're saying 2 to 3 kilometers, it means it's not the hospital that you work at. Okay, so which hospital is that? Is it a public or is it a private hospital?
Sometimes private, sometimes public.
Okay, so what you're saying is within 2 to 3 kilometers of where you live, there are both public and private hospitals around.
No, not the same. Sometimes I go to the public, sometimes private. They are not everything in the location.
Okay. 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 And do you or your family members typically use, do you pay for cash? Do you use insurance?
Okay. Myself, I have medical insurance and my husband. But my kids, since they are dependent, they are no longer in my insurance. So I'm encouraging them to join by their own with their families.
Okay, because they've passed a certain age.
Certain age. Yeah.
Okay. And what age is that?
The first one is 33 years.
No, I mean like
age after 20 years.
Okay,
then you are, yeah.
Okay. So your family members, okay, I'm going to ask you on both sides. For the family members who have health insurance, what do they, how is it for them in getting health services?
Those with the
health insurance.
Those one there is very simple. When you get to the facility, you just fill the form, then you are treated.
And does this also cover, what does the health insurance cover?
It covers inpatient services, outpatient operation services. Yeah.
What about medication? Does it cover medication? Yeah. Okay. And what if the hospital does it ever happen that the hospital doesn't have the medication that the patient needs?
If they don't have them, the doctors write the forms. Then I go to buy from other pharmacies.
But this would now be cash. Or you still
cash.
To be cash.
Oh, I can just go with that form also. There are those medical shops where they accept the medical insurance.
Okay.
So I just go with the form.
Okay. Okay. And what about for your family members who don't have health insurance?
They don't want to use cash.
They use cash.
That's why I insist them to join medical insurance.
And why do you insist them to join medical insurance?
Because you can't have cash all the time.
Okay. And how much would it typically cost to go to a hospital and pay, while if you're paying cash? How much would you spend? I know it depends on the...
Yeah, it depends. But you find sometimes 100 Tanzania shillings.
100,000 Tanzania shillings for
But it
private
depends,
private
yeah,
institution. What about government?
Government is not that expensive. Maybe it can the one you pay 100,000 in private. In private public hospital can pay maybe let's say 50 or 30,000.
Okay, 30,000 to 50,000 Tanzania shillings. Okay. And what about ambulances? How does that happen? Is it covered only for health insurance patients, or also the ones with cash? How does that work?
I think it covers ambulances.
For both patients, cash and health insurance, or just health insurance?
Even for cash.
Even for cash. Okay. And this is for all hospitals, both government and public?
In those with ambulance.
Okay. Do all hospitals, public hospitals, have ambulances?
Not all.
Not all. So what if they need?
Like there are those low facilities, like dispensaries, they don't have ambulances. Health centers.
What if they need ambulances?
They just call from the headquarters, from the hospital, district hospital, where the ambulances are.
Okay. And what does health mean to you? In order
to,
yeah,
health means that if somebody, let's say somebody doesn't have psychological problem, mental problem, physical problem, that's why you can say I'm healthy.
Okay. And you also mentioned that when I asked you why brown bread instead of white, and you said that brown bread is more nutritious. So what does nutrition mean to you?
Nutrition is when the food have all like nutrients, like minerals, vitamins, fish.
Okay. And what are your aspirations for your family members in terms of health? What do you aspire their health to be?
My family members to have health means to eat balanced diet, to have time to rest, all those kind of things which can make somebody healthy.
What about, because you also mentioned what health means to you, one of the things you mentioned was mentally and psychologically sound or stable. What would you like for that? What would you aspire for
my family? I want my families, sometimes they have to get together, they have to sit and discuss issues, and do counseling. Maybe you find somebody who needs counseling, you talk to him or her.
And do you have a tradition of counseling your family members, or do you maybe want them, or do they usually expect that from the outside sort of entities to get counseling? Do you do that yourself, or do you?
I do myself.
You do it yourself. Okay. And how do they respond to you counseling? Positively. Okay. And what are the types of health or nutrition issues for which you have the biggest needs? What are the biggest needs that you have?
Nutrition.
What about nutrition? So what are the types? What are the types of health or nutrition issues for which you have the biggest needs? So health-wise, what are the biggest needs that you
like vegetables? Normally, when we buy vegetables, we know they put a lot of chemicals. So what I need is to plant or to grow my vegetables around my yard. But the issue is the soil around my yard is not fertile. So I have to get fertilizer from the cow dung from my neighbors because I don't have fertilizer.
So for what you're saying is the biggest issue you have, nutrition issue, which you have the biggest need is chemical free vegetables. But you can't, which is your challenge is you can't because the land in your home is not fertile enough for you to be able to grow. Okay. And what about for health? Because you said that you are hypersensitive. Hypertension. Okay. So what is your biggest need in that area?
Hypertension. Diet. Yeah, there's some diet like garlic, which I can chew, and it normally reduces the hypertension. Okay. Though I'm not sure whether it was researched or what, but I had.
Have you tried it and did it work?
Once, but not for a long time ago. Okay. So I just put in the food, but I didn't chew also.
Okay.
By itself.
Okay. And so you said the main challenge you have in getting your nutrition needs fulfilled was getting chemical-free vegetables. So what are you doing about it?
Yeah, I normally go to the neighbor and get fertilizer. Yeah. So that is continuous process. So I'm still doing it.
Okay, and you said what fertilizer do you use?
Cow dung.
Cow dung. And does this work?
It is.
It works 100%.
Yeah.
What are the challenges?
But also there are a lot of insects. So those plants which normally the insects prefer. So those one I don't plant. I plant those ones which are not attacked.
Okay, usually attacked. Okay. And what do you wish for in terms of solution to those challenges?
Solution is to get fertilizer and get seeds which are not attacked by. Yeah. Because I have a lot of water which I can irrigate.
Okay. So you wish for in terms of solutions to your challenges is to get fertilizers, but also seeds that are not easily attacked by.
And also my dream, I want to grow chicken. A lot of chicken so that some we can use
to go into poultry farming.
Poultry farming, yes. Some we can use, others I can sell. That is my dream.
Okay. Okay, and what would you be able to do if your family received the nutrition you aspire for? If you're able to get chemical-free vegetables, what will you be able to do after that? If you're able to get now chemical-free vegetables, what will you be able to do?
To use the vegetables.
Okay. Okay, and what about if you were now getting chemical-free vegetables and you're using the chemical-free vegetables, will it be able to make you do anything else just because you're able to get those chemical-free vegetables?
Like business-wise?
I don't know.
Yeah, okay. That's why I say if I get chemical-free vegetables, then I have to get free poultry farm. Yeah. Yeah, to increase foods in my house.
Okay. Okay.
Yeah. Okay. Even vegetables, I want it in a bush area so that I can sell, and you can also use at home.
Okay. And for wishing in terms of what do you have any wishes or any aspirations in terms of your own health, the hypertension? Do you have any?
Yeah, I have to do a lot of exercises.
What do you wish for? What do
Wish
you,
the hypertension to be controlled.
it cannot be cured.
No, okay. It cannot be cured, but what I heard and what I know, we can use this herbal medicine. And so, like right now, I'm using herbal medicine from Chinese, and it works. Yeah.
And how long have you been using it now?
This is I think the 4th month, and I'm no longer using the Western medicine.
Okay. And do you how long have you been using Western medicine?
30 years ago. 30, like 30, almost 32 years.
32.
33 years.
Okay.
Yeah. But it didn't work. And sometimes my hypertension becomes worse.
Okay. And what would you be able to do if you were able to completely control your hypertension?
I will teach others that if you can go to herbals, then it can be better.
Okay, do you have anything else you wish to tell us about health or nutrition?
Yeah, about health, what I would like to say, everybody should prevent from the illness, like doing screening. Somebody has to be screened to know whether the person has a disease, so that can be prevented early.
Okay, and what about in terms of nutrition?
Nutrition, yeah. We have to eat nutritious food. This one is like a medicine one also. So that it can increase immune system. Yeah. Then somebody will not be attacked by diseases. The immunity system.
Okay. And how has COVID-19 changed everything now?
COVID, okay. It has changed
Has anything changed if you were to say compare it before the health system before COVID-19 and after? Is there anything?
Yeah, anything. What I know, because COVID does not have medicine. So you find that nowadays people use a lot of herbal for treating COVID. Yeah.
What kind of herbal?
They went to more like using herbals instead of using medicine from the hospital.
From the hospital. And what kind of herbals do you know?
There is this what they call Madagascar plants. Yeah, I understand this one. People use a lot of it. Then it will help.
Well, what about you and your family? Do you also use?
Yeah, we use cypress leaves. Yeah, and we mix with other maybe avocado leaves. Then we put in a pot, gray pot. Then we go in and we inhale the steam. We do like steam inhalation. Yeah.
And it works.
Yeah, it works.
Okay.
And we use a lot of lemons, ginger. We mix together and garlic. We blend together. And it's like it produces trees. And we use it frequently. So even if somebody...
You also inhale that?
No, that one we drink.
Okay.
Yeah. Then if we have even mild, like a cold, then it disappears.
Okay. Okay. And what are the biggest or the prevalent diseases in your community that you see? Patients coming.
Like now there is pneumonia. Yeah, pneumonia. there is like diarrhea, like yeah, those are the common.
Okay, and this is for all.
Hypertension, diabetes, those one are coming, are increasing. The patients are increasing. Yeah.
And this is for all age groups.
Yeah, for but most of them, like elder groups.
Groups.
Like young, there are not many. Yeah, the prevalence is low.
What about children?
There are also those children whereby we call it diabetes 1, type 1. Those you find that they inherited from the parents, type 1. It doesn't, there is no association with the lifestyle. Yeah.
Okay. Okay, and what is being done to the hospitals to help with the situations? For example, the diarrhea is this what is causing the diarrhea?
Yeah, you find waterborne. Yeah, so we give health education. We give the this medication like chlorine for the public to put in their water storage.
Okay.
And we give health education like foods. They have to wash properly their foods before they eat. Yeah. And hand washing, frequent hand washing.
And what happens to what about because I understand there are places where they're far from hospitals, like very rural. What happens to those who are far from hospital?
We have mobile clinic and outreach. Yeah, so we follow them, even like in vaccination, family planning, in those remote test areas. We follow them. So we do give the service as we give them at the hospitals.
And how do they receive these mobile clinics? How do they react to these?
They like it.
They like it. There's never been
they really appreciate because they are stranded. They are like in the middle of the jungle.
And they've never been any resistance.
No.
What about because I know family planning is a bit of a touchy subject in some societies. What about those? Is there any resistance that you get from during those?
Of course, when we go there, some they come, but most of them, others they don't come. So if they don't come, we are not sure why, because we have never done house to house family planning.
Okay.
So maybe when we do that service, that's where we can get a lot of people who don't maybe expect that. Because we find their traditional family planning. Maybe, we have to do the research on those.
What traditional family planning?
I'm not sure. That's why I'm saying maybe we have to do research so that we know if they are not using Western modern family planning. What family planning do they use?
Okay, is there anything else that you'd like to add, recommend?
Yeah, I recommend if I get some assistant, because like the question you asked me about family planning, we can't do house to house research, or survey if there is no finance.
Why?
If I get somebody who can finance me, then we can go to the village like Masai's. It will be very interesting to know which family planning do they use. Because like family planning is one of our indicator, but like now there are very few. The indicator is very low. It's like I think 48% of new clients who are using modern family planning. So want to know the rest. What family planning do they use?
Okay, Hamida, I would like to thank you again for your time that you've given us or given me, and the wonderful insights that you've given.
Thank you very much. Okay. Also, thank you because your questions were very clear.
Thank you very much.
Bye.
Bye bye.